Good afternoon to all of you. Welcome to today's Wednesday webinar from the MRSI. The topic is popping the insights pill. How does marketing and research work in the healthcare sector? Diana, if you can hit the next slide, please. As you all know, we are in the 7th season. The Market Research Society of India, MRSI for short, hosts the Wednesday webinars every month on a Wednesday at exactly the same time, 1 p.m. as we started today. Next slide, Diana. Quick introduction to the August panel that puts together the webinar. There's Amitabh Mishra, who's also incidentally today one of our panelists. He heads insights and analytics for Dr. Reddys Laboratories India. I'm Sunder Muthuraman, your session host for today. I'm an executive vice president with Ipsos MMA. Mukul is Mukul Gautam, VP and Chief of Capacity Building at Purple Audacity, and Shiv Kumar Somnathan, who's a consumer behavior consultant driving a consulting firm called Curious Cat Consulting. We put together this every Wednesday without fail, and we've been doing it for many, many months now. But let me just quickly lead on into MRSI for first-time joiners in this session. Established in 1998, MRSI is a unique not-for-profit association of providers and buyers of research of insights. The primary objectives are to create awareness of the industry among public at large, as well as the government, establish and promote professional standards, and provide a platform for professionals to engage and showcase their work and collaborate on common issues. Wednesday webinar is clearly focusing on our ability to bring you the best of experts and cutting edge work that's happening in our industry, and perhaps sometimes even defining technologies that's changing our world. That's about the MRSI. Now, quickly, let me introduce you to the speakers who you're already seeing on screen. Amitabh Mishra, like I already said, is not only a member of the committee that puts together the webinar, today he's a panelist as well. Welcome, Amitabh, in your new avatar for this day's show. And Amitabh, as I said, is Head of Insights and Analytics at Dr. Reddys Laboratories. Good afternoon, Amitabh.
Thank you, Sunder. Good afternoon, Sunder. Thank you.
We also have Gauri Pathak, Country Service Line Leader for Healthcare at Ipsos. We have Praful Akari, Founder and MD, Medulla Communication, an expert again in influencing and I guess making consumers buy the right brands. And Sanjoy Mitra, an encyclopedia of this industry, and I guess he knows. Just earlier in the before we checked into switching on this webinar, we were conversing, and I heard everybody say that there's nobody that Sanjoy doesn't know in this industry. So we are very glad to have you, Sanjoy, and your expertise and what you can share with us today. Sanjoy is the founder and managing director of SMSRC. Welcome and good afternoon again.
Thank you, Sunder, and good afternoon, everybody.
All right. So before we kick off with our panelists, just so that we get a context to why this webinar, and to give you a perspective on the pharma industry, in a comparison mode with other industries that perhaps many of us are familiar with as direct consumers. The industry is pretty large. It's 5.5 lakh crores and spends about 2,000 crores in marketing research. For comparison, on the right-hand side, you will see FMCG, which includes all the soaps and shampoos and everything that we use. I know we use it every day. Maybe medicines are not used every day by all of us, but it's still about half or more than half the size of FMCG, which we think is very, very large. And then therefore, pharma is very large in my opinion. And it's about half the size of the auto industry that spends far less in marketing research. These are information that we put together from various sources, and there's also some detailing we take from the MRSI industry report, which you can find in our website. Next slide, please, Tina. If those were in crores, we have this habit of confusing people with billions and millions and many zeros in rupees and dollars. So here's a slightly different view. Of course, the dollars and billions, go beyond my head when it crosses a few thousands. But needless to say, the reason we have this slide is to kind of contrast the earlier slide. All the numbers that I spoke about was only pharma, which constitutes only 20% of what we can call as the healthcare industry. The 70% comes from hospitals and the services they offer, and a remaining 10% is from medtech and others. So what you will hear today is perhaps context that touch upon more the first two and a little less of the last. So with that, let me lead you on to our first panelist today. Sanjoy, over to you. And tell us about, I know we've given you very little time, Sanjoy, so take us through the journey, take us and make us understand, this very large and complex industry. Over to you.
Thank you. Thank you, everybody, and very good afternoon to all the audience. So we would look at application of prescription data and research for healthcare sector. The key objective would be to define the healthcare industry and then the doctor spread, and then look into a couple of case studies. Next slide, please. Yeah, so normally, as you know, the healthcare industry is defined in India, particularly defined as a branded generics market. We believe that's more of a legal definition because we see that it's a purely branded market, and but in non-patented therapy areas with few patented products. There are very few patented products now, whereas in the same formulation, which is a generic, we can see that there are very robust brands, and most of the top brands in different formulations would account for more than 30 or 40% of the market share, prescription share. So each brand differentiates itself with the other, and therefore it's unique, and they actually create the market. That's why probably it will be better to call this as a branded formulations market rather than a branded generic market. As far as the HCPs are concerned, medical doctors who practice healthcare, National Medical Council 2024 data reflects there would be about 13 lakh plus doctors practicing in India, or registered in India, not practicing, registered in India. 80% of these healthcare delivery is done through OPD practicing doctors or HCPs, and the rest would be mostly in hospitals, which will be premium and high value generating sector, as Sunder has shared in the previous slides. Now, is there any pharma company who would be covering all the 13 lakh doctors in India? No. If we look at the unique coverage of top leading companies, it would be around 4.5 lakh doctors out of this 13 lakh or 10 lakh doctors who are actually practicing in India in OPD context, OPD sector. So then are there doctors who are not made by pharma companies? That is also not correct, because different companies meeting different doctors, and there are also overlaps. So unique coverage or maximum unique coverage by leading companies would be around 4.5 lakh doctors, and that we define as the operating universe for the industry. In this operating universe, if we look at the coverage by specialty segments across different doctor segments and classify them into super specialist, generalist, as well as rural doctors who are non-MBBS but healthcare practitioners, then the ratio or distribution of these doctors would be specialists are mostly available in urban market and headquarter towns in extra-urban, few of them, and that would constitute 33% of this operating universe. Another about 57% of the doctors would be generalists, and balance 10% would be the practicing rural doctors who are residing in rural, and they are non-MBBS essentially. Now, what does the RX reflect? RX prescription data, prescription reflects the mind of the doctor, the aspiration of the doctors while treating his patients or providing cure to his patients, his or her patient. In IPM, it reflects the primary demand generation. As we define, formulation business is the prescription generation, business of prescription generation. Until and unless we generate prescriptions, there won't be any sales for those ethical formulations or brands. RX multiplied with the dosage duration and the unit of prescription multiplied with price actually provides the sales or revenue for different companies, and collectively that sets the trend for the industry as a whole. Next slide, please. So a bit of history about prescription research. Actually, it was initiated in 1977 by my father, late Professor Mitra, and also icon and legendary icon of the industry, Mr. Torun Gupta, who was then the head of marketing in Glaxo, GSK, in 1977, with a small pilot to understand if we study prescription data trends, can we understand the aspiration of the doctor's behavior while treating the patient, and what are the need gaps and how can we bridge those need gaps. Subsequently, it was initially done manually. Subsequently, in 1986, when I joined the industry, tried to move from manual analytics to EMR data or digitalizing the prescription data to make it more accurate and make it more specific to understand the trends and behavior of different doctor segments for different disease area. And then in 1995, I remember we started our first consulting projects from data analytics and report submission to getting insights and covering solutions or offering solutions to the industry for different companies for different brands. And that's how from pure market research, we became more of a consulting firm to provide solutions to the industry. And then 2009, we initiated SMSRC as a new avatar of prescription research and became the leader in this field. And then onward till today, we have been conducting various workshops with almost all the leading companies in the country, in India and Bangladesh, and providing solutions and insight from prescription research data. We also have two other organizations within SMSRC, the clinical trial organization called MedClean Research, which is managed by Dr. Manjuri Mitra, a practicing pediatrician. And in 2017, we acquired another software company, the PMS company, which were trying to develop software for doctors to manage patients. So this is the process since 1977 until today. We have evolved from prescription data analytics manually done to EMR data-based company and providing solutions. Yeah, next slide, please. So what is real-world evidence? As you could see from the name itself, when we study prescriptions, we get the reflections, live reflections of doctor's behavior while treating the patient. It is absolutely unbiased, and the focus is only to provide best of healthcare solutions for the patient to make him disease-free or at least give relief from the disease that the particular patient is suffering from. So there are two sets of data analytics here. One is the strategic prescription research that SMSRC provides and offers to the industry, where we provide strategic solutions for almost all the companies, leading companies in India and Bangladesh, providing company-related reviews, then portfolio brands, and everything is based on prescription trends and how the market is behaving, and where are the changes, and how we can optimize our response and our offerings to fit the market requirements. And therefore, we study the brand life cycle from prescription data over a long period of time. Also offer product portfolio management solutions, because in every company, as we know, they are marketing multiple brands. So this is a complex analytics which talks about how we can develop different brands within the same portfolio by catering different brands to different segments for different disease and creating strong brand identity. We also look at disease and therapy management trends, how there is a shift from a doctor's prescription of managing a particular disease, say 5 years ago, and how they are managing the same disease today. And such kind of insights definitely help the pharma companies to augment their portfolio and innovate their marketing approach to fit the needs or aspirations of the doctors for a better patient care. And finally, the strategic solutions all put together whenever a merger or acquisition is taking place. How do we create synergy? If there are any changes to be done within the portfolio, or if there are any changes to be done in brand priorities within the portfolio of a company, we come out with the solutions and offer our recommendations. On the other side, when we look at clinical research solutions, there are real-world evidence studies conducted, retrospective and prospective, based on epidemiology data and disease prevalence trends. What are the advantages of studying these disease prevalence and epidemiology trends? It helps in understanding the changes, as I said, even from prescription data, and it's real, and from doctors' pens. from the prescription data. It is then reviewed at the peer level and then published in different medical journals. What would be the ultimate advantage? When such medical reports and journals publications are shared, information is shared with the doctors, they get greater conviction on the therapy areas, and ultimately they try to use that regime or the outcomes of these studies for better patient care. So patient centricity improves, and patient compliance and relief quality improves. Next slide, please. Now let's look at a couple of data analytics and then a few case studies. So in India, if we look at ICD, International Disease Classifications, methodology, follow that 11th edition, and look at all the disease that gets reflected in the prescription. It's respiratory disorder which features as the #1 disease in our country, with a share of 15% patients. The second one is metabolics, followed by digestive enzymes, digestive systems, and circulatory system, and so forth. On the right-hand side of this table, we have highlighted the top therapies that the doctors prescribe while treating this disease. As we could see, in respiratory disorders, doctors in India prescribe antibiotic 21%, followed by cough cold, pain relievers, which is analgesics mostly for fever management, and then the primary therapy respiratory. Now, why respiratory is fourth and not the first for the disease of respiratory? As we know that in respiratory, there could be upper respiratory problems and lower respiratory problems. In upper respiratory problems like URTI and all, mostly the doctors prescribe antibiotic, and in India, URTI is more predominant than lower respiratory. Whereas in lower respiratory problems, we have asthma, COPD and all, where respiratory inhalations and oral therapies are mostly used. And this trend is changing towards respiratory, because respiratory as a disease is progressive, and it has been growing because of pollution and other environment-related issues in India. Another interesting findings from this slide, if we look at the metabolic disorder, cardiovascular is #1. It is, and then the anti-diabetic therapy. It's not anti-diabetic and cardiovascular. And if we look at circulatory system disease, their cardiovascular is 22%, and there is no mention of metabolics or anti-diabetics within the top 4 therapies. Why so? It clearly indicates that if a patient is diabetic, he or she would definitely have cardiovascular comorbidities, whereas if a patient is suffering from cardiovascular disease, he or she might not have diabetic problems. So that is why the cardiovascular and diabetes are co-prescribed mostly for treating the metabolic disorders. Now, what are the advantages of looking at this data, and what could be the application of this particular information? When a company wants to cater to metabolic disorder patients, they not only need to offer the anti-diabetic therapy to the doctor, they also need to offer the cardiovascular therapies. The product priorities, sequence, these are important for the industry to understand and accordingly offer the therapy areas. Next slide, please. Yeah, now the previous one was from the disease point of view. If we now look at the therapy point of view, it's the gastrointestinal therapy, which is the #1 therapy, not respiratory. Respiratory is way below, and it's only 4.4. Why it is so? Because respiratory is a chronic therapy, and gastrointestinal therapy, in the previous slide we saw, GI problem is a comorbidity problem almost with all the disease areas. Therefore, GI therapies are either prescribed as a primary therapy or as a co-prescriptive or adjuvant therapy with most of the other therapies. So collectively, GI therapy becomes #1. Now, the application of this particular information is when I am prioritizing a GI therapy, I can understand the usefulness of GI therapy, not only to the gastroenterologist, but also to all other segments of doctors. Yeah, next slide, please. So if we look at respiratory disease, where we have mostly 2 inhalation therapies, the metered dose inhalation and the dry powder inhalation, over a period of 5 years, if we look at the distribution of DPI and MDI, then it has been mostly MDI, and for 54% in 2016, which is now 63% in 2022, and 46% DPI, which has come down to 37%. One of the leading company in this particular therapy area has also offered their therapies to the doctors, particularly chest specialists over here, what we are seeing as a segment of doctors, in the same sequence. And they have been developing this particular market over a long period of time. Therefore, they had an advantage of almost a monopolistic share within this therapy area amongst the chest specialists, who is the #1 segment. Yeah, the next slide, please. Yeah, this is the last slide to talk more about an example of a case study on clinical trials. So we did a clinical trials on 3 different antibiotics with a focus on particular antibiotic A, to see whether this particular antibiotic is more effective in the management of pharyngitis, which is an upper respiratory tract disorder. So patients were randomly prescribed all the 3 antibiotics, and the patient outcomes were monitored after prescribing these antibiotics in terms of efficacy and relief. And it was found that antibiotic A was offering better solutions to the patient or relief to the patient. So this particular information, when communicated to the doctor from this clinical trial, which is a live clinical trial across so many patients, it creates better conviction for amongst the HCPs to prescribe that particular antibiotic A for treating the indication called pharyngitis. So such data-based information and real-world evidence helps in better patient care. That's about it from our side. Thank you so much.
Thanks, Sanjoy. I'm sure on every slide that you put up, you could have easily spent half an hour explaining, the trends and, what has happened with our country and several perhaps acute and chronic diseases over time. Without doubt, I'm sure our listeners will have several questions for you. Sure. Just making an announcement before I invite Gauri over. In your panel, on the webinar panel, you will see a questions section where all attendees, you can raise your questions for any of our panelists, not just for Sanjoy, for those that are coming in later as well. For those joining us for the first time, we will not have the capability to have a voice interaction with our panelists. So if you have questions, you will have to type them in this window. And later in the session, depending on how much time permits, I'll bring those questions up with a specific panelist or all of the panelists. Gauri, over to you. Tell us about what's happening now, with research in this space, and how are you and I as patients changing?
Thank you so much, Sunder, and hello everybody. What I'm going to talk to you about today is a bit about the kind of work or the kind of research that we do in terms of understanding how patients take decision about their healthcare and how physicians take decisions about treating their patients. Most of the work that we do is in the custom research space, and hence I have taken some examples that can give you an idea of what happens in that space. Next slide. So one of the key trends that we see in healthcare, and this is something that we've taken from the Ipsos Global Trends report, is that contrary to old times where healthcare used to be very symptom relief based, right? So you have a symptom, you take a medicine and you get relief from it. Versus that, healthcare is increasingly become holistic, it has increasingly become more integrated. There is a shifting focus from cure to prevention, and you would see a lot of probably promotion of nutraceutical health supplements, a lot of noise around preventive health. That is another emerging trend. There's also a growing role of technology in terms of the way people and doctors manage health. And finally, a lot of focus on self-reliant healthcare. So overall, if you see, there is a higher empowerment that the patient has currently in terms of managing his or her own health. Next slide. So in this context, I would first talk about patient-related research, right? And when we say patient, we are talking of somebody who's suffering from a particular condition or a disease. Typically here, two types of research become relevant. The first one is the patient journey research, which tends to be uh, framed as describing how individual patients experience a condition and its treatment. So, for example, I'm taking an example of diabetes that is very well understood here by most of the people. So, how has been the patient journey from symptoms to diagnosis to getting treated to managing the diabetes? So, that is all about patient journey. There's also another bit of research which is called treatment flow research. Now, here it is slightly different. As we know, overall in the treatment funnel, there are many leakages, right? So not all people who suffer from conditions may be diagnosed. Not all those who diagnosed may receive treatment. Not all those who receive treatment may follow or adhere to the recommended treatment. So there are leakages at each stage. So the treatment flow research typically focuses on identifying where these leakages are, what are the cause of those leakages, and what we can do to essentially fill up those gaps. Next slide. Talking about patient journey research, where typically it is used. At the core, this research identifies who are the key stakeholders that influence treatment choices, right? So how much is the role of the doctor? Do peer group interactions play a role? Are paramedics involved in decision making? So it identifies the stakeholder network and the kind of influence that these stakeholders have. How is this condition diagnosed? What information sources do patients rely on? We see a lot that patients go very well prepared to doctors, right? When they meet them. So what are the kind of information sources that they rely on? What is the emotional journey that patients typically experience at each stage of the treatment continuum? So essentially, why would a pharma company or a healthcare company commission this kind of research? It helps them to support HCPs to have more effective conversations with their patients. It helps them to communicate with patients. It helps them to position their brand in a way that interventions are more effective. Essentially, it helps them to get a holistic picture rather than simply understanding the doctor. They also understand the patient and their journey. Next slide, just to give you an example, you can see this is what a typical patient journey flow map would look like. For example, you'll see the practical flow here from symptom awareness to first consultation with the doctor to diagnosis to initiation of the treatment, follow up, any change or switch in treatment, and present day. And at each of these steps, we get the emotional journey of the patient. You can see tolerable, clarity, accepted, hope, etc. And also the influence network, which influencers become most important in terms of decision making for the patient. Now, this is extremely important in chronic therapy areas research. For example, cardiovascular diseases, cancer, asthma, diabetes, of course, obesity, cholesterol management. Because for a drug company, they have to accompany the patient throughout that journey, and hence understanding critical insights at each step of the journey becomes very, very important. Next slide. This was about patients, and now coming to understanding the physician decision-making process. And often I get questioned, is physician decision making so complex? Don't doctors simply prescribe the products that are mentioned as per the guidelines? Interestingly not. Doctors are also human beings. There are also emotions involved when they make treatment choices. A lot of factors come into play. So understanding the physician's decision making process is equally important. Next slide. There are three key aspects that usually healthcare companies want to know when it comes to brands. And this is no different than consumers, right? How do doctors make decisions about their treatments? What do doctors think about their brands and how they think about it? and how are they influenced, right? So who are the key influencers when it comes to their decision making? Again, very similar to consumer research. So let's come to the first one, how doctors make decisions about treatments. Decision making, next slide. While decision making about treatments is governed by guidelines, medical guidelines, a lot comes into play. And I have just shown you an example where we have analyzed drivers of treatment choice using impact scores and IBN analysis. So if you see here, for example, for this particular condition, while efficacy, advocacy by peer groups or colleagues is important, also important is how effectively the product is preventing disease progression. Is it requested by patients? So are patients aware about the product? Is it well tolerated? Is it recommended by key opinion leaders for this particular therapy areas? So similarly, for each of the therapy areas, you could get such impact scores in terms of identifying key drivers of decision making. Not only that, you could, as you know, decision making is not so linear, right? So you could get a structural map or a tool in terms of understanding the interrelationships between these factors. For example, here you can see there is a strong interrelationship between efficacy and prevention of disease progression. Next slide. The second thing is, how do doctors think about brands? And as Sanjoy said, our Indian pharma market is dominated by branded generics or branded formulations. And there is very poor differentiation of one brand versus the other. In this context, is it important for us to understand what doctors think about brands? Yes, we believe so, because the research that we have done clearly identifies some brand differentiation. In this example that I'm showing you, we have used what we call brand mental networks for us to identify relationships of some of these, I would say, features of the brand with what the doctors think about the brand. Here we have used NLP, and you can see for this particular brand, for example, the perception is that it is very patient friendly, easier for the patient, easy to use, easy device, etc. Next slide. Finally, how doctors get influenced. And as we know in pharma, the sales rep is one of the most important influencers, right? That is the main medium by which doctors get influenced to write prescriptions. So here, typically, four things become important. First is the detailing of the sales rep. So we measure the effectiveness of that particular detailing, the frequency, recency, share of voice, quality of detailing of the sales rep, the message recall. So whatever messages we are conveying about the brand, are they recalled appropriately? Are they associated with the brand? Are the primary messages differentiated from the secondary messages? Diagnostic for the messages. For example, are these messages relevant? Are they motivating? Are they believable? Essentially, all this helps the companies to sharpen their messaging to doctors. And finally, measurement of sales rep performance on various factors. This really helps the pharma companies to refine their training programs for their reps. How do you benchmark performance of the sales rep versus some of the other competitors in terms of some key important drivers of sales rep satisfaction? So overall, if you look at custom insights in healthcare, both on a doctor as well as patient level, there is a lot that goes into it, a lot that is similar to what is done in consumer research, in fact. And at a broad level, it's about making a decision about their brands. Thank you.
Thanks, Gauri. I think that was a nice progression from what Sanjoy shared with us. Obviously, a lot can be done with collecting information on what is prescribed. It helps us understand prevalence of diseases, what therapies are getting prescribed, and perhaps then find a right formulation that can kind of meet those needs. And Sanjoy kind of elaborated on that. And what you spotlighted on is two user groups or two critical groups in the pharma context. One is obviously the practitioner, the healthcare practitioner, and what research can help unearth, or how can pharma marketers use this information. And you started off your session by speaking about how patients' journeys need to be understood before making a particular choice, either by a healthcare practitioner or by a pharma marketing company, on what needs to be communicated, right? So I think it's a nice segue, I would say, to kind of invite Amitabh, who's bang in the middle of a very large pharma marketer, influencing decisions that the company makes with insights. And I'm sure he has some wonderful case studies to share with us on how insights played a role in impacting the success of a formulation that Dr. Reddys had. Amitabh, over to you.
Thank you, Sunder. I have been a market researcher insight professional for the last 22 years now, and I have worked in FMCG for maybe 10 plus years, and also in banking media, and now in pharma. I think while I enjoyed working in FMCG and other sector where market research is very, very cutting edge and very advanced, can you go to the next slide, Diana? So what I find very fulfilling about my stint in Dr. Reddys and pharma is that we actually try and make a difference in a patient's life, and help doctors make a decision, sometimes even what they are not aware of. And here's an example which I'll talk about. So Dr. Reddy believes in good health can't wait, and that's patient first philosophy. So what happened, and we keep on going through the data, mining the data. So what we saw was that lots of dermatologists, the patient going to dermatologist or dermatologist are writing interacts to diabetic patients. So we were like, why is this happening? So because you go to dermatologist for itch, sure, but why are so many diabetic patients? So we kind of had few questions. Is there a relationship between diabetes and itch? Do healthcare person, professional knows the difference? So what we did was we called a study called knowledge, attitude, and practice. Can you go to the next slide, please? Now, so these were so when we looked at some data, global data, we realized that India has about 10 crore to 13 crore diabetic patients in India, and but the concerns about itch and diabetic. So about 50% people have pruritus. Pruritus is itch, basically, who have reported itch. But the concern was there's a lack of awareness, delayed consultation, increased symptom severity, lack of standard guideline, lack of India-specific evidence. Now, you will think knowledge, attitude, and practice is like a user and attitude study which you do in a FMCG or any other sector, but it's a bit different, and I'll talk about how it is different. So just go to the next slide, please, Diana. So what knowledge, attitude, and practice is a study which actually understands real-world practices of the doctors. So what you do when you do this study, you actually get the key opinion leaders. So key opinion leaders here means super specialists, doctors who have lots of experience on it, or influencers in doctors community, if you ask me. So there's a steering committee which is created of endocrinologists. They are involved in all the research design, how we do it. There is a protocol which is defined, which is approved by ethics committee. And so it cannot be about only, let's say, a branded kind of a thing. It has to be understanding the knowledge, attitude, and practice without bringing brand into play. And it is completely monitored by the key opinion leaders and ethics committee. So about this study, we did this study with about 300 HCPs, which is doctors. Please go to the next slide. And we had a starking results. So 60% of consulting physicians thought there is no connection between diabetes and itch. Only 10% doctors acknowledge that there is a coexistence of diabetic and itch, and 30% of doctors were not sure if there is a link or not a link. So 60% said there is no connection. Absolutely, they didn't think there is a connection between diabetic and itch. So that means 90% of doctors were actually unsure or unaware about relationship between diabetic and itch. So go next. So we created this campaign, and it was more stuff because when you go to an endocrinologist or a diabetologist, you talk to him about your diabetes, but you don't talk to him about your itch, because you don't think it is something, as a patient, you don't think it is something which is related to diabetes. And similarly, you are not, even the endocrinologist is not aware, or diabetologist is not aware that he asks this question, that do you have itch? He asks about your blood sugar fasting, HbA1c, and other comorbidities, but he will not ask you about itch. So then we created this campaign. Dia, can you please play the video?
My husband and my kids refuse to eat the food that I cook.
I fail to focus in my meetings. I have a constant fear that my colleagues are talking behind my back.
I have sleepless nights. Imagine sleeping with your hands tied.
My anxiety is such that I am always worried. What if this happens in front of my clients?
I have no confidence to step out for social gatherings. I have stopped wearing the clothes which I want to. Look what I have done to myself.
Itching in diabetes leads to a significant physiological and psychological impact. This World Diabetes Day, we solicit your intervention to help these diabetes itch patients attain a better quality of life. Attack the diabetes at first sight. Atarax, because patients are itching for relief.
And these testimonials are, so while the actors have actually was shown in this communication, the verbatims are all from the consumers. So we have actually taken consumer verbatims and put it here with the actors, naturally, because we couldn't get the we could show actual patients. So with this campaign, can you please go ahead? And this study was then actually published even by American Journal of Dermatology and Venereology. So it got a good publication because it was done in a manner which was suddenly eye-opener for the doctor, and we could see that the prescriber base among consulting physician and prescription share both went up. So doctors now started asking about itch to their patient, which they were not asking, or the endocrinologists and diabetes like that. So we solved the unmet need of a patient, or underserved need of a patient. So this is how I think a pharma research in a pharma market research is used too. And we have done many other things also. We have come up with a device called Nereview, which is about it's a device which helps you with migraine treatment. Again, migraine is one of the most unmet need in this market, in the people who suffer with migraine, because most of the time they will tell you that there's nothing which works in a migraine, and we came up with a device which actually helps them. So that's about me from me. I think over to Praful now.
Thanks, Amitabh. Praful, if you can get your camera on. And Amitabh, it's quite interesting to note that whether it's a doctor or a patient, we don't know enough about what can be done. And it's useful to keep in mind that Insights is about generating those nuggets that can help all of us have a better relief or a better life. Praful, over to you. I'm sure, your job's never easy because communicating about diseases and treatments and etc. is always difficult. It's, patient mindset is always about suffering. So tell us about how Insights, gave us communication that made a big impact. Over to you, Praful.
Thanks, Sunder. Yeah, the job's never easy, but it's always fun, thankfully. So hopefully we'll send some of that fun today in the presentation.
Sure.
My background's been that as I start off, my background's been that I started my career in on the marketing side, so the client side of things, first with Ranbaxy, and last as in 2008 as the head of marketing for Pfizer Consumer Healthcare. And at that point, I crossed over and moved into founding my own agency, Medulla, now one of the most awarded healthcare advertising agencies in the world. But really, if you ask me what's the piece that united marketing and advertising, then it's what you see on the screen in front of you, which is insights. I'm very happy to speak about this today. Diana, if you can just go to the next slide. I'm going to start with showing you some campaigns, some communication campaigns that are based very, very deeply on insights. And this is one of the campaigns I'm most proud of. It's one of the most awarded campaigns in healthcare advertising across the world. And literally, once we had the insight, the creative and communication literally wrote itself. So Diana, if you could just play this, let's start off with a bang.
Mrs. Raksha Mehta, a very lovely person. Her last words है, my special salt tadka.
I love you, Michael. मिसेस डैश ने मुझसे कहा क्योंकि मिस्टर डैश नहीं थे वहाँ, इसलिए मुझसे कहा.
She gave me this recipe to give to a family.
સાઠીના હતા મિસ્ટર અગરવાલ. સડન હાર્ટ અટેકથી એડમિટ થયા. એના સન અમેરિકામાં હતા.
Mr. Bose, middle-aged, very jovial Bengali fellow. All of a sudden he became very serious.
મારા બેટા આયા? મારા દીકરા આવી ગયા? એના છે એના લાસ્ટ વર્ડ હતા બસ.
And he said, Amar meke bolbe, Amar meke bolbe. Tell my daughter I approve of her choice.
एक छोटा लड़का था, शायद 8 साल का, उससे भी कम. उसके लास्ट वर्डिंग थे मम्मी को बाय बोलना.
शमीना, उसने मुझे से कहा
60 वर्षाच्या त्रिपाठी बाई मला जाताना सांगून गेल्या,
श्रीकृष्णन के आखिरी शब्द थे वड़ा सांबार.
अंधेरे से मुझे बहुत डर लगता है.
माझ्या नवऱ्याला सांगा मुलांची आणि स्वतःची काळजी घ्यायला, कारण त्यांची काळजी घेणारं मागे कोणी नाही उरले.
उनके लास्ट वर्ड थे सॉरी, बस सॉरी सॉरी.
मिस्टर अय्यरचे शेवटचे शब्द होते, कधी कोणाला तुम्ही जाताना पाहिलं का?
Sorry, I should have warned you all about the category and the topic before we get in. I normally do, but my bad on this one. So very quickly, what this campaign really teaches us is that insights, and this is from a marketing perspective. It, of course, teaches us a lot about life, but really insights are gold in marketing. And while Amitabh and has taken us through how those insights are identified through market research, one of the things that I learned here was that when you have a really deep insight, you just know that this is the insight that the complete campaign can rest on. As you would see from a communication perspective, the rest of it was very simple. We just took real nurses. We asked them about the real last words that they had heard, and we literally recorded that. The campaign wrote itself. And even if you see the communication, it's very simple. Most last words are heard by nurses. That literally is that insight is where the film lands. And therefore, palliative care can help change that. And that's the proposition for palliative care that we literally use in the campaign. Since we've been talking about healthcare professional communication and as well as consumer communication, the case study of this campaign and how we brought it alive with healthcare professionals across the country on social media, I think will also be very interesting for you all. So, Diana, if you could just play that.
Dignity of life is a human right. To die with dignity is also a human right.
Palliative care provides comfort and dignity in death. The IAPC has established infrastructure, but only 1% of eligible Indians avail it, since they just aren't aware. The insight? Since doctors keep terminally ill patients in ICUs, most last words are heard by nurses, not families. Could these dying last words bring alive the need for palliative care? We interviewed 200 nurses across India. The most heart-rending last words they heard became our film.
उसके लास्ट वर्डिंग थे मम्मी को बाय बोलना.
मिस्टर अय्यरचे शेवटचे शब्द होते, कधी कोणाला तुम्ही जाताना पाहिलं का?
The film was launched at the IAPC conference by the Human Rights Commissioner, with doctors pledging their support. Launched digitally to consumers, the campaign garnered over 100 million impressions. The film was viewed over 500,000 times. Thousands of personal last words poured in. The video reached 50% of the 100,000 socially active Indian doctors, generating personal last words. The website captured pledges that will be used to initiate policy change and offered support kits that connected consumers with doctors. Last words generated 8 million rupees of unpaid media and trended at number 3 on Twitter. Palliative care professionals across the world adopted the campaign, as did members of parliament. Now, the last words are finally being heard.
Yes, if you could just go to the next slide, Diana. This is this is the perfect slide. This is one of the most awarded campaigns across the world at Cannes Lions to the Oscars of advertising. It won 2 gold lions, a silver lion, and again won across lots of other awards as well. Was recognized as one of the top 15 campaigns of the year by the Gun Report. This is way back in 2016. Again, literally when we had the insight and we were brainstorming on the campaign, when we had the insight, we knew that the rest of the campaign was writing itself. It was literally, we were blessed to have that insight, and that respect for an insight comes with campaigns like this. I want to show you one more campaign which is very, very different. This is a campaign for a muscle building protein supplement. Some of you might even have used it. It's called Muscle Blaze. The campaign was called Tum Nahi Samjhoge. Again, we'd done this a few years back. This was a portfolio brand at that point. Muscle Blaze was the only Indian brand, the leading Indian brand, but the international brands were overshadowing the Indian brands. And this brand then had one of the highest lapsing rates, and therefore they were very worried about that. And we said, as a portfolio brand, more than talking about the product, what we really need to do is just understand the consumer. And therefore, again, the insight and connecting with the consumer was far, far more important on this campaign than anything else. I'll play the 2-minute online video for you once again, and then talk, and then we come back and talk about the insight.
तुम नहीं समझोगे, क्योंकि तुमने कभी एक ही एक्सरसाइज 1000 बार नहीं की। सूरज से पहले कभी दुनिया नहीं देखी। अपने आप से शायद कभी परफेक्शन नहीं मांगा। तुम नहीं समझोगे, क्योंकि तुम्हारे लिए वर्कआउट तो सिर्फ एक न्यू ईयर रेजोल्यूशन है। कभी तुम्हारे लिए थोड़ा अर्ली और कभी बहुत लेट है। तुम नहीं समझोगे, क्योंकि तुम डिसिप्लिन भी एक ऐप की तरह डाउनलोड करोगे, और अगर तुम नहीं समझोगे तो शायद तुम हम नहीं बन पाओगे। मसल ब्लेज जो समझे हमें।
Again, this campaign is, I mean, the insight pretty much was at the heart of this campaign as well. We realized that folks that were gymming, especially had been gymming for at least 6 months and were the big users of this category, were people that were misunderstood by their friends and families. Everyone would make fun of them, saying, you are you do all of this because you are very vain, you want to focus on your looks, and they really did this because they felt good, and they didn't want to have to explain that, and therefore the thought of tum nahi samjhoge. But what's also very important in this is that this campaign featured real gymmers, who've later become, gone on to become big influencers in the country in the gymming category. And all these exercises were really performed by them. But more than that, all these insights, every line of the film was actually an insight that was gathered by talking to these gymmers. And there were things like, तुम discipline को भी ऐप की तरह download करोगे. There were lines like तुम्हारे लिए कभी बहुत जल्दी है, कभी बहुत late. तुम कभी अलार्म के पहले नहीं जगे. each of these was an insight for us, and therefore the market research almost goes hand in hand with the process of building the communication. And with that, hand over back to Sunder, knowing that our time's almost up for today.
Thanks, Praful. Very insightful, very moving campaigns, I would say. Thank you for sharing it with all of us. And it's been quite a journey. I mean, it's just been 1 hour, but we've just taken a whirlwind tour, starting with how prescriptions help the pharma trade and the practice, and how research is done in this space, how research is brought to life and used as a pharma marketer, and last with you, Praful, on impactful communication that moves, I guess, millions of people. Thank you for that. Like you rightly pointed out, we are at the end of the session. So we'll just quickly go to a few announcements and close. What we will, in fact, request all of you is, for the questions that come up, it will be shared, and you can respond back, and we'll host it along with the recording. So just a quick announcement: the 32nd MRSI annual market research seminar is up and ready, 23rd and 24th September 2024 at the Taj Lands in Mumbai. If you haven't registered, do so. There is an early bird offer that you can benefit from. Next slide, Diana. Well, if that's the last, I guess it's thank you. Thanks all for taking the time. We are a minute over. We do worry about it all the time. So not bad. A lot of very intense content, and each of you made significant effort to make sure that you could keep to the time. It's unfair, but we just in a webinar we try to tick many boxes. Thanks again. Thanks for taking time. Thanks for being the stars of today's show. Good day, and we'll meet again. Thank you, audience. Bye-bye.
Thank you.
Bye.